Hi, everybody. Welcome back to the Pelvis Party. My name is Becky Montpetit. I am the owner of Rochester Local, and today I'm here with Britt Marschall, but our special guest is Dr. Braun. Dr. Braun is the chair of Obstetrics and Gynecology at Olmsted Medical Center. And of course, Britt Marschall, she's with Communications and Marketing at Olmsted Medical Center too. Welcome. So happy that you're here.
Thank you so much. Thanks.
Dr. Braun, it's your first pelvis party.
It is. I'm so excited.
I know. We're excited to have you. And the topic, it's a good one. Period. Right? We have to deal with them. It's part of, having all of this downstairs equipment. And so one of the things that we kind of want to talk about and address with periods is how to manage them and all the ways that we can manage them. And I guess I'm curious, as someone who is practicing in the clinic with patients who are coming in and talking about their periods, has the conversation changed at all around periods, or is there, something that's more prevalent now that wasn't a couple of years ago when we talk about periods?
Oh, that's a really good question. So I feel like the ways that it has changed are that, and you could kind of mention this before too, patients just aren't settling for this is how life is going to be with this heavy, painful period. And I feel like we're getting more patients coming to OBGYNs for help, which I think is great, right? Yeah. I mean, a lot of patients will come, you see patients who have missed, days of work, days of school, and then they're finally coming and reaching out for help.
Yeah.
And I feel like patients are coming a little bit sooner.
Mm-hmm.
So the word's kind of getting out that you don't need to struggle in silence, and
right.
it's not taboo to talk about your periods.
Do you think anything has to do with the fact that we're really pushing towards normalizing talking about women's health and the conversations that people are having, and just really encourage, it's just more open to talk about it than it was a couple generations ago. And I'm sure that's probably contributing to people coming to the office too.
Definitely. I feel like mothers are having those conversations with their daughters, or anyone really.
Mm-hmm.
It's more free to talk about and have those conversations at home before,
Mm-hmm.
and then people can identify that doesn't sound quite right. Maybe you should talk to a specialist about that, or
Sure.
And also other primary care providers also are great at kind of fielding those questions and sending them to us when they see a problem.
Mm-hmm. Mm-hmm. So I know historically it's always been, here's a pad or here's a tampon to deal with periods, right? Are you seeing patients kind of explore more options? Has that been a little bit more prevalent, or are you really still seeing the two avenues?
No, it's great, right? There's lots more options that patients can kind of figure out what they're most comfortable with, which is what it's all about, right?
Right.
We want them to be comfortable and have it be kind of the least bothersome, right? Time of the month. But it's, between the menstrual cups, period underwear, there's a lot more options than when I was young. So it's really great to kind of see that patients can figure that out and try more than just the pad or the tampon. And there's also,
are you finding that patients are looking the information up before they come to see you, or is it something that you're explaining what there is?
Oftentimes they know more about it than I do, to be honest. They're like, well, I tried this and I really like this. And I'm like, oh, I put that in my back hat to I'll tell other patients about that. Because, it's great to share information, right? But the other thing is just, also besides just having the pads and the tampons, right now there's organic, fragrance-free, low chemical, things that are really going to be helpful for patients in preventing irritation.
Yeah. Right.
It's
sure.
really great.
And I mean, it's a huge market, right?
It is. Yeah.
There's just the endless supply of brands, and then, lines within the brands and all these sorts of things. I remember, and something that we've talked about on Pelvis Party before, is I struggle with heavy periods. I didn't know, actually. No one tells you on a scale of light to heavy what heavy actually is. And I thought, well, certainly, this is no big deal, right? This is no big deal. So people have way heavier periods than this. Well, it turns out my periods were so heavy, it made me super anemic. And it was terrible and it was bad. And I remember thinking when I was going through, I remember my favorite brand of tampon came out with an ultra tampon. And I was like, yes. Because it just improved my quality of life. I wasn't having changing as often. But then also I was like, this is sad. This is actually really sad because I was still struggling with ultra and there's no step beyond ultra. And that's kind of when I was thinking, I need to have a conversation. So I guess I kind of tell that because when do you suggest people really talk to their primary care provider about what they think a heavy period might be?
Right, that's a good question too. So I usually tell patients, and it's hard with the other options to kind of gauge, but usually if they are using a pad, if you're using a pad, like a super pad or even just a regular size pad, and you're soaking through that pad
Yeah.
in less than an hour,
Mm-hmm.
that's definitely too heavy. Come see
Mm-hmm.
us. Or soaking through that ultra tampon in less than an hour.
Mm-hmm.
Other ways to gauge it, if you're waking up in the middle of the night to change your pad or menstrual cup or tampon, that's a good sign.
Yeah.
That you need to see someone.
Okay.
Or at least have that discussion. If it's occasional, like, oh, it only happened once, maybe it's still within normal. But you have patients I have patients that come to me and they're like, well, yeah, whenever I'm waking up 2 or 3 times a night to change my pad, and it's like, that sounds very disruptive of your sleep, and then schedule the next day.
Yeah.
And so those are kind of the things that we talk about. Or if you're doing normal activities and then all of a sudden you're soaking through everything, like having those like gushers, that would be concerning.
Yeah. Also, something that's maybe not pleasant to talk about, but I think it's really important that we talk about is clotting and
Yeah.
what happens around that and what's normal and when do you need to be concerned about that sort of scenario. And, again, it's not pleasant to talk about, but I think we need to go there and talk about it.
Right. Yes. So, larger blood clots can occasionally be normal, but usually, more than the quarter-sized clots. If patients are coming and saying, I have golf ball sized clots, it's like, oh, that sounds very intense. Yeah. Even a
Yes.
quarter, that's fairly large. Like if you passed one occasionally, okay,
Yes.
you write it off. But if you're having those every single period, that's a concern.
And it's painful. It is. Well, when again, I'm really going there, but that was something that I really struggled with, and it was actually extraordinarily painful. Like the pain was with the menstrual cramping that was associated with it was not pleasant, and it was
No.
every month, and so I wonder if it's just a good idea for people to be talking about their cycles with their primary care provider regardless, because then change can be documented, right? So if it's,
Right.
normal every 27 days, every 29 days or whatever, and what it's like, at least that conversation can be started about that area of your health. I would imagine. I don't know.
Right. Yeah. And as a gynecologist, it's first on the list, right?
Yeah.
How are your periods? Tell
Right.
me about them.
Yeah, right.
How are they going? And yeah, how frequent, because
Mhm.
it gives a lot of information about the woman's health,
Yeah.
right? And if they're ovulating, and just it's very helpful for
Yeah.
their whole well-being.
Yep. Well, there's a lot that we could talk about regarding periods. And in our next episode, we're actually going to be talking about hormones, which relates to our periods. But we will save that for our next episode. So thank you to Dr. Braun and for Britt for joining me for this episode of Pelvis Party. And if you are interested in watching more, and there's a lot of great topics, you're going to want to visit rochesterlocal.com/pelvisparty.